Welcome back. The Centers for Disease Control estimates that 1 in 59 children is identified with autism spectrum disorder.
Dr. Tina Iyama-Kurtycz is a developmental pediatrician. She spent decades devoted to the clinical care of children with autism spectrum disorder. She's retired now, and that gave her time to write this book. She is the author of the book Diagnosing and Caring for the Child with Autism Spectrum Disorder, a practical guide for the primary care provider. Dr. Iyama-Kurtycz, good to see you.
Nice to see you.
Congratulations on the book.
Thank you so much.
Now, you wrote this book primarily for physicians who are going to be treating children?
Primary care providers. So that now includes nurse practitioners and physician's assistants who are doing a lot of the heavy lifting in primary care.
Because when I was reading, I noticed you mentioned when you were early in your career, an autism diagnosis was quite rare.
We only diagnose the most severe children.
And now?
And now it's a very broad spectrum, but they all have some similarities. They all have some difficulty with social skills and communication, the ability to relate to other people. Those are very common, and it's also associated with some behaviors that are...
And you wrote this book for physicians, but parents could get something too. I mean, it's an easy read. It's not all technical.
I wrote it to be an easy read. I wanted it to be accessible and conversational so that people might read it. That was the goal.
So was your motivation to write it because as a primary care provider yourself, you faced challenges dealing with children with the diagnosis? Or?
No, the motivation was that I did want everyone who saw children or who see children now to be able to recognize who might be on the spectrum. I've learned so much over the years. I've learned from our team at the Weissman Center. I've learned from parents and children. I've learned so much. I just wanted to share it.
Oh, that's wonderful.
What do physicians look for? What are some telltale signs?
Delayed speech is probably the most common presentation, but parents may notice poor eye contact. They may notice their child doesn't interact like their other children in a social way. So some of those kind of concerns coming to a doctor or a primary care provider should raise a pink flag.
What progress has been made in treatment? Is there a cure?
No, there's no magic cure for it. There's no fad intervention that's going to work. What works is the hard, everyday work of parenting. And for parents to hang in there, because people can help you get to where your child is as successful as they can be.
That's a positive and a reassuring thing to hear, but this is a devastating diagnosis for parents.
It usually is. I have been in situations where parents are like, well, finally somebody said this.
We know what's going on now.
But most of the time it is a life-altering, at least, diagnosis.
Are the incidences of Alzheimer's, autism, thank you, autism spectrum disorder on the rise? There's a perception that cases are increasing. Is that the reality?
Well, there are more children and adults being diagnosed with autism spectrum disorder, but we have radically changed the criteria. So we've changed the whole definition of what autism is, and therefore people with milder conditions are getting included. They still have to have trouble with social skills, trouble with communication in a back and forth way, but yes, it's just a very broad spectrum.
So the diagnosis has changed.
Yes.
So if you have a child that you are concerned about, tell your doctor about this book.
That's right. Yeah.
There we go.
That's a good start.
Good to see you. Thanks for being with us. Congratulations on the book.
Thank you for asking.
Congratulations, Tina. Good to see you.
We'll be right back.